According to TikTok, I have autism, so please respect my diagnosis, was what someone told me at a party not long ago. So let's talk about why she most likely don't have autism, even though social media says she does. Autism, also known as autism spectrum disorder, is a complex developmental disorder that affects an individual's social interactions, communications, interests, and behavior. It is called a spectrum disorder because it manifests differently in each person, ranging from mild to severe. Autism is typically diagnosed based on observed behavior and developmental history. Many of the misconceptions about autism stems from misinformation often spread on social media platforms. It's essential to understand that self-diagnosis, especially based on casual observations or online quizzes, isn't a substitute for a thorough assessment by a qualified healthcare professional. As a psychiatric nurse, I've witnessed the importance of accurate diagnosis and appropriate treatment firsthand. So let's just get a little disclaimer out of the way so we can dive into the content. I am a licensed Danish nurse, but that doesn't make this medical advice. Instead, this is educational, and a proper diagnosis involves comprehensive evaluations by a team of professionals, including psychologists, psychiatrists, and speech-language pathologists. These assessments consider behavior, communication, developmental history, and various other factors to provide an accurate diagnosis. With that out of the way, let's focus on the goal of understanding autism. It is not only to debunk misconceptions, but also foster a more inclusive and empathic society. By promoting accurate information and open dialogue, we can reduce stigma and provide better support to individuals with autism. So let's explore the true nature of autism and the available treatments, aiming to enhance our collective understanding of this disorder and improving the lives of those affected by it. Let's dig into the diagnostic criteria and the different types of autism. In the world of mental health diagnosis, the ICD-10, known as the International Classifications of Diseases, is widely used as a diagnostic tool when it comes to autism. The ICD-10 categorizes it under pervasive developmental disorders. The diagnosis is based on specific criteria, including difficulty in social interactions and communication, as well as restricted and repetitive patterns of behavior, interest, or activities. On a side note, the only country that doesn't use the ICD-10 as the main diagnostic tool for autism is the USA. They use the DSM-5, but they are, well, almost aligned in this respect, so I will use the ICD-10 as a basis, but that doesn't exclude it from the DSM-5, so American people there, you can still watch and learn. Now let's talk about the three main types of autism spectrum disorder that the ICD-10 identifies. In the ICD-10, autism disorder is an F diagnosis. And F diagnosis, I'll get much more into depth with that when I open up and talk to you about what is the ICD-10 in a later episode, so make sure you're subscribed and click that bell notification icon so you get notified when that video comes online. But back to the matter at hand. F84.0, autism disorder. This is what people most commonly associate with autism. Individuals with autistic disorder displays significant challenges in social interactions and communications. They often struggle with forming relationships and may exhibit repetitive behavior or obsessive interests. These symptoms usually manifest before the age of 3, and that makes it an infantile disorder, which means that you have to have these symptoms before the age of 3. Otherwise, there are some other types of autism you will fall in under if it displays later in life. The second one is the F84.5, Asperger's syndrome. Asperger's is characterized by difficulty in social interactions and restricted repetitive patterns of behavior and interests. However, individuals with Asperger's usually have average to above average intelligence and language development. They may struggle with social cues, making friendships, and might have intense interest in specific topics. And the third one is F84.8, what I will call the garbage can, the pervasive developmental disorder not otherwise specified. This category is for individuals who don't meet the specific criteria for autism disorders or Asperger's syndrome, but still display significant challenges in social interactions, communications, and behavior. It's often a milder form of autism. What separates these types of autism are the intensity and combinations of symptoms. The diagnosis involves a thorough evaluation of a person's behavior, development, and function across different areas of life. Understanding these distinctions is crucial because it guides appropriate interventions and support strategies. It's essential to approach each individual on the spectrum with a tailored approach that addresses their unique strengths and challenges. In the next part of this discussion, we'll explore how early diagnosis and interventions plays a crucial role in improving outcomes for individuals with autism. So stay tuned as we unravel more about this important topic. But first, if you want to know more about each diagnosis of autism and mental health in general and nursing in general, then click the subscribe and the bell notification icon because I'm planning to delve more into these topics. But let's return to why early diagnosis of autism is fundamental for improving outcomes and enhancing the quality of life for individuals on the spectrum. The early years of a child's life are a critical period for brain development and the acquisition of essential skills including social interactions, communications, and behavioral regulation. Identifying signs of autism early allows for timely and targeted interventions which can significantly impact a child's developmental trajectory. Early signs of autism often manifest in the first 2 years of life. These signs might include limited eye contact, delayed speech or language skills, difficulty with social interactions, and repetitive behavior. When parents, caregivers, and healthcare professionals recognize these signs early, it triggers an early evaluation and intervention, which leads us to early intervention programs. These are designed to address the specific needs of the child. They often involve a combination of therapies such as speech and language therapy, occupational therapy, behavioral therapy, and social skill training. Tailored support helps in developing communication skills, improving social interactions, managing behavior, and enhancing overall cognitive development. And by intervening early, we can work towards maximizing a child's developmental potential. Early therapies aims to migrate challenges associated with autism and enables individuals to lead fulfilling and productive lives. The goal is to equip them with the necessary skills to integrate successfully into society. And that is why early intervention also educates and involves the family. Parents and caregivers receive guidance on how to support their child's development, managing behavior, and creating an enabling environment at home. This involvement is crucial for the continuous progress of the child. And that leads us to the long-term benefits, because research consistently shows that early intervention has long-term benefits. It can lead to improved communication abilities, enhanced social interactions, better academic performance, increased independence, and improved quality of life as the individual grows into adulthood. So by now we know that early diagnosis and intervention plays a pivotal role in the lives of individuals with autism. By identifying signs early and providing appropriate individualized support, we can make sustainable difference in the development and well-being. In the next part of our discussion, we'll explore some common misconceptions about autism and shed light on the truth that should be acknowledged. First misconception: autism is a single disorder with uniform characteristics. Truth: autism is a spectrum disorder, which means It manifests differently in each individual. The spectrum includes a wide range of characteristics, abilities, and challenges. Some individuals may have exceptional abilities in certain areas, while others may face significant developmental difficulties. Second misconception: people with autism lack empathy or emotion. Truth: individuals with autism often experience emotions and empathy, but they may express them and perceive them differently. The misunderstanding may arise from challenges in understanding social cues and communicating emotions effectively. It's important to recognize and respect their unique ways of expressing emotions. Third misconception: autism is caused by vaccinations. Truth: extensive research has debunked the myth that vaccines causes autism. There is no scientific evidence linking vaccinations to the development of autism. Autism is a complex neurodevelopmental condition with a multifactorial origin, likely involving a combination of genetics, environmental, and neurological factors. Fourth misconception: autism can be cured. Truth: autism is a lifelong neurodevelopmental condition. While early interventions and therapies can significantly improve outcomes and quality of life, there is no cure for autism. The focus should be on providing appropriate support and tools to help individuals reach their full potential. Fifth misconception: autism only affects children. Truth: autism is a lifelong condition that impacts individuals into adulthood and throughout their lives. While symptoms often appear in early childhood, the challenges and strengths associated with autism persist into adulthood. Support and understanding remains crucial throughout a person's life. Misconception number 6: autism is linked to intellectual disability. Truth: while some individuals with autism may also have intellectual disabilities, autism itself is not synonymous with intellectual disability. Many individuals with autism have average or above average intelligence. Autism affects a wide spectrum of cognitive abilities. The 7th misconception: all individuals with autism have savant skills. The truth about that is that savant skills characterized by exceptional abilities in specific areas like memory or calculation are present in a minority of individuals with autism. Not all individuals on the autism spectrum possesses these exceptional skills. That is why understanding and dispelling these misconceptions is crucial for promoting a more informed and empathic society. By challenging misconceptions and fostering understanding, we can create a more inclusive and supportive environment for individuals with autism. By now you have become a little smarter on autism, and if you want to be smarter on another condition that is so misunderstood, then check out this video about ADHD. I'll be looking forward to seeing you over there, so click that video right now.